RSV is the #1 reason why babies go to the hospital in the U.S., according to the CDC, with 100 to 300 babies who die of RSV per year. Thankfully, there are immunizations to prevent that, and this season, doctors say it should be easier than ever. It's one sign a baby is struggling with an RSV infection.
Just tons of mucus. Babies have to be suctioned in their nose and then breathing fast. These little babies have to breathe maybe 60, 80 times a minute. They're breathing so fast they sometimes can't eat well.
RSV, or respiratory syncytial virus, feels like a cold for most of us, but for older people and infants, it can be dangerous.
Often why they need to be hospitalized is because they can't get enough oxygen.
HealthLink talked with 2 local pediatricians about how to prevent your baby from having to go to the hospital because of RSV. While supply wasn't always up to speed when the FDA approved RSV immunizations last year, doctors say supply is back on track now.
We're really trying to get the word out because we know how effective these immunizations are.
Expecting mothers in their 32nd to 36th week of pregnancy can get an RSV vaccine, which will pass along antibodies to their newborn. Or babies up to 8 months old can get a monoclonal antibody injection to protect them during the respiratory infection season.
Most kids by the age of 2 get an RSV infection, and it can look like a normal cold, but to very young infants and older adults, it can be very serious.
Dr. Carrie Jenner, a pediatrician at Virginia Mason Franciscan Health, recommends babies as young as 1 week old get the antibody.
Which seems very early. What would you say to parents who might feel nervous about that?
Yeah, so what's so exciting is the severest risk for severe RSV disease is in the first 3 months of life. So that's why I think it's so important and so amazing that we can offer this in that first week of life.
The burden of disease is very great.
Dr. Maria Huang, an Olympia-based pediatrician, says parents should pay attention since RSV infection can lead to health issues later in life.
We know that increases their risk of asthma and wheezing with colds in the future. And so it's not just the hospitalization, but it's more long-term effects we want to protect babies against.
As for older adults, the CDC recommends all people 75 plus and adults 60 to 74 years old with increased risk should get the RSV vaccine. For HealthLink, I'm Christine Pei.